Alright, I'm going to explain about all the different types of x-ray holders. So in each room there should be a little tray like this in the cupboard, and usually you'll see some x-ray holders in it like that, but I've just gotten them out for the video. And you will also see there should be two size 2s in each room. Size 2 is the most commonly size used. We usually use size 2 for everything, but if it's a child, or if they have a strong gag reflex, or if we're doing, I don't know, a PA of a lower incisor or something like that, we might use a size 1 or a size 0. So if you're getting out x-rays for the dentist, just always get out 2 size 2s, but unless they ask for a size 1 or size 0 specifically. Each room has got 2 size 2s in it, but in the if you want size 0 or size 1, then that'll be in this box in the hallway where the ScanX unit is. Okay. Alright, now I like to use the stickers if the patient has a strong gag reflex, and then I would just use sticker and a size 1, but the sticker, you can use it for any type of PA or bite wing, but usually I try to use the reusable ones. Okay. Alright, for a checkup and clean, would normally get out the yellow bite wing holder. So yellow is for bite wing because bite wing just means that, I don't even know what they mean on it, but they bite and you've got an even view of the top teeth and the bottom teeth. So wait, do you want to hold this? So I usually put the A towards the front and the black towards the tube, but the dentist will probably do this, but if you want to set it up, you can. And then if you have a look, there's an even amount on the top and the bottom, so you can see the top teeth and the bottom teeth to check for any cavities, but it won't show you the actual roots. So that's called a bite wing, and that's just a purely yellow one. But this red is also bite wing, and so is this red. So there's 3 different types of bite wing holders. We might even have another one that does bite wing as well, I can't remember. So that's bite wings. My normal bite wing setup is like this for me, for Francis, and then for Winston it will be like this. This one is a spare, and then Sandra, but most people like the yellow one, it's pretty accurate. Okay, now I'm gonna go through the different types of PA. Alright, this is posterior PA. So it actually says posterior on it, but it's quite in like the same color as the thing, but it's posterior because it's horizontal. Okay, and then when you want to put the ring on it, so you can see how it's almost like a Y shape here, so you slide it on, and then whichever side this is on, you slide the ring towards that and slide it up, but the dentist will usually do that. And then this is anterior PA. It says anterior on it, but the other thing to remember about that is we have another one for root canal that is also green, but this part is different. And then these are a different brand, but I prefer these yellow ones, the Hall one, but then we do have this brand as well if you run out of the yellow ones. So this is anterior PA and this is posterior PA. The majority of the time, if the dentist asks for a PA, they're asking for the posterior. So like this one, if they ask for PA, if I'm doing a, I think I showed you, if I'm doing a checkup and clean, that it would just be bite wing and 2 x-rays. But if it's a pain appointment, then I want posterior PA and a bite wing and 2 plates, because I'm going to use 1 each rather than doing like 1 bite wing on each side. We'll do 2 x-rays of the same tooth, but the PA shows the tip of the root as well, not just the top part, like the crown of the tooth. Okay, if it's an emergency and it's a front tooth, then you'll just give the green one by itself, because you can't do a bite wing on the front tooth. This blue one, I don't usually have to use it, but that's if they're missing a lot of teeth. It can just help you get a different angle if you can't quite get it with any of the other ones. And then if you come over here, in surgery 3, we have some more x-ray holders for root canal. I prefer this one for posterior. That's called endorin or something. So that's the green one with the metal arm. And then this one is good for anterior for root canal. So you'll notice that this one and this one almost look the same, but the difference is here. So the one that's for root canal has a little, we call it a basket, but it basically just has a place for the file to fit through. And the normal PA doesn't have that, it's just flat. Okay. Now, another thing, in surgery 1, we have the little handheld x-ray x-ray unit, the Nomads, or the, it's Bartek, but it's like a handheld one that you can walk around with, portable one. So with the handheld one, it's a bit different. I actually usually put these on kind of backwards if I'm using the handheld, so I just get a bit more space. But if they have if the x-ray holders have got this stick, then you won't actually be able to get right up to it with the handheld. So that's why I've cut them off on one of each type, just so that we're able to get right up close to it with the handheld. So because then I can push the x-ray machine right up to it, because it's got the guard around it for the radiation. Okay, I hope that helps. Thank you for watching.